Hello, everyone. We'll get started in just about 30 seconds. Okay, I will get started. So welcome everyone to UCSF's quarterly climate hub meeting, which we now opened up to a larger audience today. We are very excited to have you all join us. My name is Dr. Sherry Weiser, and I co-founded and co-direct the University of California Center for Climate, Health, and Equity, along with Dr. Ariane Teherani. The mission of our center is to harness the expertise and leadership of the health sector to drive ambitious climate action for health and health action for the climate. We are based at UCSF and at UC Health and span all 10 campuses and 5 health systems with over 100 affiliated faculty. And on a quarterly basis, we support the Climate Hub, which builds community and provides a space for UC researchers, clinicians, staff, and students to connect and bridge silos. And the goals are really to share ideas and projects, foster collaborations on climate and health education, on healthcare sustainability, and on community engagement related to climate change and health justice. And the Climate Hub is co-facilitated by Dr. Heather Whelan and Dr. Hilary Ong, who I look forward to introducing shortly. So today's session will be focused on climate and health medical education efforts at UCSF. And we are really excited to have a panel of expert speakers who will be presenting 10-minute flash talks on their progressive and innovative work related to really integrating core climate and health learning objectives and educational content into preclinical and clinical training. Due to time constraints, we're going to go through all speakers without stopping for Q&A until the end, but please do share your questions in the Q&A section of the webinar, and we'll have time for questions at the end. And before I turn it over to our speakers, I'll share their bios briefly in the order with which they'll be speaking, and please note that Dr. John Quinn was unfortunately not able to join us today. So Dr. Orlando Harris is an associate professor of nursing in the Department of Community Health Systems in the School of Nursing, and also associate professor of medicine in the Division of Prevention Sciences in the Department of Medicine at UCSF. His research focuses on risk and protective factors in sexual and gender diverse communities of color in the United States and in the Afro-Caribbean diaspora, and on understanding the relationships between intersectional stigma, violence, mental health, and HIV. And he's also co-chair of education for our UC Center for Climate, Health, and Equity. Catherine Grunberg is an associate professor of clinical pharmacy in UCSF School of Pharmacy. Dr. Grunberg also serves as an infectious disease and antimicrobial stewardship pharmacist at UCSF Medical Center. She is passionate about environmental sustainability in pharmacy education and practice, and leading many of the climate and health initiatives from the School of Pharmacy at UCSF. And Heather Whelan is a professor of medicine in the Division of Hospital Medicine at the San Francisco VA Medical Center and UCSF, and also co-director of career advising for the UCSF School of Medicine. She is also co-facilitator of our center's Climate Hub and the director of the UC Climate Ambassador Program, which is a program sponsored by our center to really develop climate and health curricula across the health professional schools, throughout the UC system. And Dr. Whelan is committed to developing and disseminating climate and health education for students, trainees, and faculty. And last but not least, Dr. Hilary Ong is an assistant clinical professor at UCSF and practices pediatric emergency medicine. She has a special interest in the intersection of pediatric emergency medicine and the health impacts of climate change on children. Dr. Ong is currently working with Drs. Gandhi and Quinn on developing a longitudinal climate, health, and equity curriculum for the UCSF's emergency medicine residency program. And like Dr. Whelan, Dr. Ong is also a co-facilitator of our Climate Hub and very involved in our center's work. And these are our speakers. Welcome, everyone. Thank you for joining us. And I'll turn it now over to Orlando.
Thank you so much, Dr. Weiser. Good afternoon, everyone. I want to get through my slides quickly so I can show you the products that came out of the course that myself and Dr. Susan Chapman created here in at UCSF in the School of Nursing on climate change. So let me go ahead and I'll share my screen so that I can queue up the PowerPoint. Okay. All right. Are folks able to see my screen okay? Yes? Excellent. All right. I wanted just to just take you guys quickly through the why we created this course in the School of Nursing. And thank you again for the introduction, Sherry. So we know that the link between climate change, health, and social justice, it's quite clear. We've seen it. The effects of climate change also exacerbated structural racism and inequalities, causing perpetual sort of like disparities within communities of color. Climate change itself also contributes to higher rates of health morbidity and mortality, and thus we sought funding from the innovation funding here at UCSF to create this new course on climate change and health. So while in terms of some of the background on that, there were no courses in the school that addressed this issue in the School of Nursing. And so we had students who had approached myself and my colleague, Dr. Chapman, around creating a course around this topic because they were deeply interested in it. And so we sought funding from the Innovations Fund for about $5,000 to create this new course. We worked to get a TA who worked with us to implement the course. And so this year that just passed, this past spring, was our second year of making the course available. So we went through a whole process within the school to ensure that the course was sustainable even after the funding ended. And so we sought approval from our Master's Programming Council, which governs the master's student curriculum within the School of Nursing, to not only get the course approved, but to make it part of one of the core requirements for our specialty program, which is the health policy and public health program. And so myself and Dr. Chapman, who is in the Department of Social Behavioral Sciences, came together, co-created the course, and then launched it. So we wanted to make sure that the course was action-oriented, that it was rooted in social justice, hence the title, Climate Change, Health, and Social Justice. And so we went about creating key factors and data in global health change. We designed the course so that it examined influence of environmental, racial, economic, and social policies on climate change, as well as to analyze how global health policy is developed and role of healthcare workers in championing climate justice. And then the last bit of that was to then create or develop strategies to address migration, climate refugees, and global displacement of healthcare workers due to climate change. So students really went deeply into understanding what it meant, the multiple impacts of climate change, not only on health, but also on the workforce, not just in the US as well, but globally. And so we structured the course, which is around a 10 to 11 week sessions, weekly sessions, 2 hours, mostly in person. In fact, the first year we went a mix of in-person and hybrid, but we decided to move fully to an in-person course, and so it's offered once a week. So we have lectures, guest lectures, discussions, small group work on assignments. And then the first assignment is for students to write a letter to the editor or an opinion or an op-ed that they need to published in either their local newspaper, school magazine, or even a national audience to educate folks on climate-related issues that they were seeing within their communities. And I'll show you some examples of actual student publications that they submitted. They got extra credit if they did get it published, but they had to submit it to their a local newspaper or a local publication for periodical for publication. And then the other piece is that for them to create this climate change educational video group project. So the first part of that is a written project. So they had to go and had to go and research it. What we explained to them was that they needed to come to class, because there's 10 students in the course. They came to class each with 3 topics that they were deeply interested in. I placed all 30 topics on the board, and by a process of elimination, having students vote for topics on the board. So I explained to them they shouldn't be wedded to the topics because they'll likely get voted off the island, so to speak. And so ultimately we ended with 3 to 4 topics, and that was the topic for that they will write their proposal on. And the next step is to create this video that they will present in course, and then of course to have a social media dissemination aspect of it and a 1-page infographic. The purpose of this course, like I said, was action oriented. So we did not want them to write a 20-page paper that went nowhere. We wanted to see the final product and for the community to see it as well. So if you could see here, each year for the 2nd year in a row, we had a number of students who have gotten their publications, their op-eds or letter to the editor published. I think 1 or 2 students always try to aim for the New York Times or the LA Times. And while it's a very high bar, most students get their papers published in their local community newspaper. And so I explained the second assignment. This is the infographic that students will have created that they post on social media to promote climate change impacts on their particular topic that they chose. So in this particular infographic, the students wanted to create this green beauty project movement, social media movement. And so they created that infographic there. And I'll show you an example of what that looks like in this educational video. So if you bear with me, let's see if you can hear the...
Hey TikTok fam, it's your girl, Glossy Gladys here. Get ready with me while we spill the tea on eco-friendly beauty. Get ready for a makeup tutorial with a twist. We are not just serving looks, we're serving knowledge about the impact of beauty products on the environment. Did you know that over 13,000 cosmetic products, including more than 5,000 lipsticks and eyeshadows, rely on mica for shimmer effects? The sad reality is that mica mining for cosmetics causes deforestation and perpetuates child labor in countries such as Madagascar. That's a lot of shimmer, but at what cost to our planet and human rights? Now, let me spill the tea about what's really in our products. While 14,000 harmful chemicals in personal care products have been banned in 40 other countries, can you guess how many were banned in the US? Just 12. And according to the study by the CDPH, a staggering 83% of the 57,000 cosmetic products they tested contained titanium and potential carcinogens. We need more bans, people. Our beauty should never come at the expense of our health or the environment. But that's not where it ends. Did you know mega companies like Target and Sephora might be playing a sneaky game called greenwashing? They slap on false green labels on products that might actually contain harmful chemicals. But guess what? The FDA isn't mandating ingredient testing. So we could be exposing ourselves to cancer, reproductive harm, and neurological defects without even knowing it. We can't let them fool us, besties. Mwah! Kiss goodbye to personal care products and companies that harm the planet. Let's support sustainable brands like Honest Beauty and Beauty Counter, who are leading the way with their clean initiatives and efforts to reduce waste. We can also utilize resources like EWG's database to find the hidden toxins in your personal care beauty products. It's super simple. All you have to do is enter your product on the EWG app and it will give you a breakdown of the product's profile. Brace yourselves because what you may find may not be pretty. If you're on the hunt for some serious natural alternatives, you can follow my girl at Beauty of Nature. This incredible soul is an absolute genius when it comes to creating your own DIY organic makeup in crafting natural alternatives that are truly game changers. Thanks for joining me on this makeup and eco beauty adventure. Remember to read those ingredient labels and avoid nasties like parabens and sulfates. Don't forget to raise awareness about sustainable choices and join our beauty revolution. #GreenBeautyNow. Be empowered, make conscious choices, and protect your health and the environment. Ciao!
What you saw in that video, or the narration, are the three students, the different voices are the three students in that group, and the young lady in the video is one of the students who decided to act out that piece. And so just want to make sure that I wanted you guys to see what it looks like when we have students really do these action project-based type of assignments versus a paper or a report that just sits on their computer. And so I wanted to also end by saying that the other thing that we did for this class was because we took a stepwise approach to create this course. We then evaluated our programs to see our program to see how we can incorporate climate change throughout the public health policy program. And then we submitted this piece to AJPH that was later published. The plan now is to offer this course across the different concentration and to ensure that it continues to remain relevant in the school. And I'll stop there.
Thank you, Orlando, for your wonderful presentation. I love the TikTok video. Catherine, if you can take over to share a screen, and wanted to remind participants again, thank you for attending our session today. If you have a question, please post it to the chat and we'll try to get to your question at the end of the session.
Great, thank you so much, Hillary, and good afternoon, everyone. My name is Catherine Grunberg, and I'm going to be sharing some experience I've had so far implementing environmental sustainability principles in a pharmacy curriculum. I'm going to actually start off my talk by sharing some slides that I share with my students to illustrate the process I've gone through in terms of delivering this information and engaging students in critical decision making. So let me introduce the patient case. Patient TM is a 60-year-old person with a history of COPD. He uses a budesonide formoterol metered dose inhaler and an albuterol MDI as needed. TM is a farm worker in Santa Rosa who has struggled with poor air quality due to wildfires and extreme heat. TM worries about how climate change has impacted their health and livelihood. What can we do for patient TM? I then go through a variety of different explanations about the impacts of climate on health and how pharmaceuticals are contributing to that issue through both indirect emissions as well as direct emissions on the environment and environmental pollution. We circle back at the end of my presentation and with our patient TM to discuss some mitigation and adaptation strategies that we could share with this patient. For example, thinking about the mitigation strategy of reducing greenhouse gas emissions through certain initiatives like optimizing medication use, avoiding unnecessary or ineffective or more carbon-intensive treatment. For example, for our patient who is taking 2 metered dose inhalers, we discussed the fact that metered dose inhalers are themselves very potent greenhouse gases, and literature such as life cycle analyses that have shown that metered dose inhalers have a 20 to 30 times greater carbon footprint than dry powder inhalers. And so we would discuss, what types of questions could we ask our patient to see if they might be a candidate for a dry powdered inhaler, taking into account their preferences, things like dexterity, cost, and discussion of the impact of their metered dose inhaler on the environment. We also just talk about the impact of optimizing disease control on the environment, discussing certain studies like the Sabina carbon study, where greenhouse gas emissions were significantly higher in patients who had uncontrolled asthma compared to those who were well controlled, and the ways in which pharmacists can help promote better disease state control. We talk about adaptation strategies, thinking about this patient in terms of the exposures that they're having to wildfire smoke, for example, and having the conversation with the patient about creating a disaster preparedness plan, taking into account things like communications for disasters. Do they have a way of understanding whether the air quality in their area is poor and at which air quality they should try to stay indoors? Do they have access to masks, indoor air filtration? As an employee, making sure that they're available, making sure that they understand their rights according to California law, that certain employers have to take certain measures in order to make sure outdoor air quality is appropriate for individuals that need to work in that area. And that could be things like changing the locations where they work, providing respiratory equipment, etc. The examples that I've just provided are kind of towards the end of what I would call the pharmaceutical life cycle. And this graphic was created by my colleague, Haley Blackburn, who's an associate professor at the University of Montana School of Pharmacy. And I really like it because it illustrates the many different ways in which pharmaceuticals can impact the environment. So in the prior example, we talked about things like what medication the patient is taking. So that could be an intervention at the point of prescription. We can also talk about things like appropriate disposal of inhalers as well. But there's a lot of other impacts that pharmacists can make in earlier parts of the pharmaceutical life cycle. Thinking about things like incorporating green chemistry and taking into account the ways in which we research and develop pharmaceuticals. Discussing the manufacturing and production processes and ways in which those companies can take into account more sustainable processes, distribution, and then also thinking about things like patient travel. That there's a really interesting study that I share with the students about how, though appropriate drug disposal does help mitigate the direct impacts of medications on the environment by circumventing things like flushing medications down the toilet or throwing them in the trash, if individuals live in more remote areas, there are really significant greenhouse gas emissions that come from patients traveling to those drug disposal sites. And so we talk about other types of ways in which we can ensure safe disposal through things like mail back options for certain patients. So this brings me a little bit to how I've collaborated with a number of individuals in developing this program on climate change and health in the School of Pharmacy at UCSF. And first, I tried to think about, the opportunities that presented themselves. So thinking first about our student body, I'm really fortunate to work with students who are really passionate about this topic and have a variety of different skills that really we need to just lift up their voices in terms of them being problem solvers, change advocates, leaders. And this is a great area in which we can collaborate with students to really encourage change. Another a way in which I was able to incorporate this content within our curriculum was due to a curricular change that our school was undergoing. So just about a year before I was hired in this role, our pharmacy school was undergoing a major curricular change. And that provided an opportunity for all of our faculty to gather together to review topics. And I was able to bring climate change and health to the table at those discussions. This resulted in the incorporation of climate and health into 3 different sessions. We use an Oregon-based curriculum. In our first year, there's a session on climate and health in our respiratory block. And then in our second year, students are introduced to this content in our neurology and infectious diseases blocks. In addition, I wanted to highlight a number of student co-curricular groups that we have within the School of Pharmacy. There is Project Safe Medication Disposal, where students will participate in health fairs around the Bay Area and educate patients about the importance and availability of safe medication disposal. We also have the Alliance for Pharmacy Sustainability, which is involved in a variety of different initiatives here on campus. In terms of the goals of these different educational sessions, The respiratory session is really intended to first introduce students to this topic of climate health and strategies that they can incorporate using the lens of airway diseases. In the neurology session, because the students are now in their second year of the curriculum, they've now had some initial training in the respiratory session. We have the students engage in more analysis and problem solving. So students read a scoping review about the impacts of climate on mental health, and then they then participate in a small group discussion with their colleagues, working through 2 case vignettes, one local example of climate impacting mental health and one global example of climate impacting mental health. And they use the information that they've gained in reading that scoping review as a foundation to help identify different problems that the patients may be experiencing and solutions that could be explored. Lastly, in our infectious diseases session, we encourage a variety of different researchers who do research in the area of climate and infectious diseases to come into our classroom and speak to students about the research that they're doing in order to give our students exposure to this type of research and hopefully encourage interest in pursuing this research in the future. I'll just wrap up now with an overview of some of the successes, challenges, and next steps. It's been really wonderful to provide this education, particularly for our students, because they're really interested in this topic and they're always eager to get more involved and learn more. So it's been great to see that the sessions have been overall well received. One challenge I've been encountering is just how to best assess application of this knowledge. I am able to incorporate one question in our summative exam for the respiratory session, and I'm sort of continue to tweak that question year after year, trying to find the best ways of assessing this knowledge application. We did participate in the Planetary Health Report Card this past year, and if you're not familiar with that initiative, I encourage you to check it out. It was really helpful for us to explore, you know, where there might be other opportunities to incorporate climate health topics in our curriculum. We're also participating in the UC Center for Climate Health and Equity Climate Ambassador programs. That will give us another opportunity to reevaluate our curricular materials and maybe develop some new ones. And then lastly, our major national pharmacy organization is about to publish a statement, a policy statement, in which they're encouraging the incorporation of climate health factors into pharmacy curricula. So I'm looking forward to reading that policy and incorporating those recommendations. And thank you so much. I will pass it off to the next speaker.
Thanks, Catherine. That was great. I'm the next speaker, and so I'll just dive in. Let me just share my screen. All right. So I'm excited to have the opportunity to talk with you all today about some of the climate and health education efforts at UCSF and beyond. There we go. So my goals for this talk are to give you a little bit of background about climate and health education at UCSF prior to my getting involved, and then to speak a little bit more in depth about a project called the CHASE, or Climate Health and Sustainability Education Curriculum Project, talking about some of the strategies we use, successes, challenges, and then useful resources. And then finally, we'll speak a little bit about the UC Climate Ambassador Project that we've mentioned already. So some history about climate and health education at UCSF. I was fortunate coming into this work in that there were actually quite a bit of pre-existing resources. There's a component in the medical school curriculum called Inquiry, which is really focused on developing analytical skills and assessing the literature. And they have a 2-week elective course every winter. And there had been a climate and health offering for several years. Additionally, students put together their own climate and health preclinical elective in 2019. And then finally, some of the members, founding members of the center here, Shay Weiser and Ariane Teherani, took part in developing a UC-wide faculty development for sustainable healthcare across the health professions, to help health professionals in 6 different disciplines develop content and teach this at their campuses. So I came to this work in 2019 when I was fortunate to partner with a junior faculty member, Nick Iverson, and we applied for a medical education grant here to work on climate and health curriculum for the undergraduate medical curriculum. And so this required some approval from the Associate Dean of Curriculum. And our goals were really to create a longitudinal, comprehensive curriculum that was focusing on the impacts of climate change on health, principles of healthcare sustainability, climate justice, and then to really try to just integrate or infuse this content into the existing curriculum as a strategy to not take up too much space and make it feasible. So just to give credit where it's due, just wanted to show some photos of the team. Nick Iverson is up there on the upper left, and then these are all students that worked with us and were critical in the successes of this project. So our process and strategies, the planetary health report card has already been mentioned by Catherine Gruenberg, and this is an initiative that was started by one of our students and others, really looking at metrics across different medical schools initially and institutions around climate and health education, sustainability efforts, research, and they basically came up with grades and they publicly published these, and you could have a comparison to other institutions. And so this actually served as a needs assessment for us because they'd already done a deep dive into some of the educational offerings. So our team reviewed existing resources, literature, whatever curriculum was already out there, and we worked together to develop a pretty comprehensive curriculum roadmap with foundational concepts in climate and health and learning objectives that we hoped would be incorporated into the UCSF preclinical curriculum. So we approached curricular leadership to really highlight for them that there were lots of points of synergy overlap between the existing core content and climate and health content. And then also tried to highlight how health equity and anti-oppression issues are foundational to climate change and health issues, and that this could be a good overlap to illustrate health disparities, anti-racist principles. And our aim was to integrate small amounts of content throughout the curriculum where there was natural overlap. We did targeted outreach to course directors and lecturers in F1, which is the preclinical block, to see if they were interested in collaborating and willing to work with us on incorporating some content. And the strategy we ended up using was we really functioned as a consult team where our students would take a look at the lecture slides, find a place where they felt they could insert something important to climate and health, develop the slides and send it back and work with the lecturer to incorporate that. And that was a pretty successful strategy and low effort for the faculty. So our successes were that we developed this pretty comprehensive curriculum map, and you can see here, including things like goals, learning objectives, content area, session objectives, suggested teaching strategies, and then where to place it in the curriculum. Unfortunately, this map has not been implemented yet at UCSF, but we did have an opportunity to work with the Global Consortium on Climate, Health, and Education and the CRHE, or Climate Resources for Health Education project through the Global Consortium to contribute our learning objectives along with some other institutions, Harvard and Emory and some others, to developing a set of core learning objectives that is offered on their website, and also to contribute to developing evidence-based open resource problem-based learning cases and slide decks that could be used by anybody who wanted to take them from the website. We did have some small successes in integrating some content into the F1 preclinical courses listed here. Pretty much as I mentioned, maybe a slide or two. And then this is kind of a messy slide, but it's just a very quick snapshot of a small portion of the curriculum map to see how we organize things: overarching curriculum goal, climate topic, the objective for the curriculum, content area, session objectives, and then some suggested session content. And this is for infectious disease. This is also another example. This is a slide that one of our students developed to put in a COPD and asthma lecture. And it really just highlighted that there are certain neighborhoods and communities that have been historically redlined, oftentimes are urban heat islands, and have worse air quality than most other areas and worse respiratory health outcomes due to those issues. So in the successes that we did have, I think the reasons really were that we had this team of really dedicated, motivated, knowledgeable students who developed this curriculum map, developed content, reached out actively to course directors and built relationships with them, collaborated with them, were very professional, provided these high quality materials that they could incorporate. And in this process, we were fortunate to find a couple of faculty champions who have continued to give us opportunities to incorporate more content into their portion of the curriculum. I think other things that were really instrumental were building relationships outside of UCSF as well with some of these organizations I've mentioned, just for mentoring, for sharing resources and ideas, and then also moral support. And then, of course, we had a lot of support and guidance from some of the faculty here in the center, including Ariane Teherani. So challenges and barriers that we faced, very crowded curriculum, limited space for new content, and a lot of competition for that space. Our curricular leadership just was not really that engaged. They felt that it was important, but there wasn't a lot of collaboration in moving this forward. The lack of confidence and knowledge skills of the faculty is a barrier in developing and teaching this content. And then the content that we did incorporate was a very small footprint. There was no evaluations component, so it's difficult to understand what students actually learned. There's no guarantee this will remain in the curriculum, no funding, administrative support. And then a bigger issue is just the lack of a national curricular policy that would require this to be incorporated. So some additional successes in the last year are some more content that we're able to develop, insert into the inquiry curriculum. So we had last year and will this year a panel including some environmental justice advocates in the communities. We had a small group last year focused on air quality and equity issues, really with a focus on advocacy efforts that students could take. And then this year we'll be incorporating some content on biomonitoring. We have a case-based didactics in the core clinical clerkship of medicine at the VA. That's a diagnostic conundrum with a heat-related illness case. And then future plans are to start trying to do outreach with the Bridges coaches who are longitudinal coaches for our medical students. And they do quality improvement projects that last a year and a half with the students in their clinical environments. And so really encouraging them and giving them the resources to think about developing a healthcare sustainability project, patient education, or climate adaptation project for their upcoming projects. And then we're continuing to engage with the School of Medicine curricular leadership to see what's possible in terms of integrating content. Last exciting development is the Climate Ambassador Program, which has been mentioned. So this was conceived of and sponsored by the UC Center for Climate Health and Equity. Been working on it for several months, but just started September of this year with a 9 to 12 month project period. And we were fortunate to recruit faculty student pairs in pharmacy, nursing, public health, and medicine from across the UC campuses with the goal of identifying gaps in climate and health curricula in their healthcare discipline and at UC schools. And then to develop some curricular roadmaps for climate and health curriculum in their health professions that could be used really by anybody who wanted to try to incorporate this. They'll be developing a couple of standalone educational sessions that, again, materials would be available and could be used by others at other UC campuses or institutions, and then creating a library of resources for those trying to do this curriculum development work. And these are sponsored by from some small stipends for both the students and faculty. And our hope is just to really grow in interdisciplinary collaboration amongst all of these pairs, generate ideas and support, and share materials going forward. And that's all I've got. Thank you so much for your time and attention.
Thank you so much, Heather. I am up to just give me a second to share my screen. And again, as a reminder, I know there's some questions posted on the chat, and just keep your questions coming. All right, are you able to see my slides okay? Great, thank you. So thank you, everyone. I'm super excited to be representing my team today, which includes Dr. Kavita Gandhi and Dr. John Quinn, who are both emergency medicine physicians here at UCSF, to talk about our climate medicine curriculum as part of our ED residency program here at UCSF. So last year, Dr. Gandhi and I got together, and not only did we talk about our own sort of worries and concerns of climate change, but we felt that it was important to educate our residents at a graduate medical school level, medical training level, to educate them on the impacts of climate change and health inequity issues. So this really started like a passion project. So we wanted to educate ourselves first. What is climate medicine? So climate medicine is about the impact of climate change on patient care. It's about workforce training, so educating our students and our residents and our staff across the hospital. It's about environmental justice. We strongly believe that environmental justice should be the center of all climate solutions. And perhaps something more specific to emergency medicine, disaster emergency management, especially in the face of extreme weather events. And in climate medicine involves healthcare sustainability, and I do think a growing and emerging field in the clinical space now. And lastly, I do believe in academia, we should continue to lead in climate health research work. So in preparation of how can we present this to our leadership, Dr. Gandhi and I thought about three main goals and objectives for our curriculum. So first is to introduce emergency medicine physicians to climate change and its impact on health and equity issues. Second, to understand how climate change affects our care delivery to ED patients. And third, to provide tools and resources for those interested in education, climate health policy, research, and advocacy as it pertains to climate change, health, and equity. We sent out a survey to our group of residents and faculty and received 19 responses out of 150 plus members, and okay response rate. A lot of first year interns responded and a good number of attendings responded. And we asked three open-ended questions. First question is, what do you think are important topics to address in this climate medicine curriculum? Second is, what would be supportive of your, how would this curriculum be supportive of your learning of this material? And third, perceived challenges of learning of this material. In terms of topics, responded wanted to learn how an ED physician can play a role in climate solutions. And a lot of respondents were interested in healthcare sustainability efforts, and specifically a waste reduction, as we're pretty wasteful in the emergency room. And third, many wanted to learn more about environmental justice work and also solutions as well. How can this curriculum support your learning? Many people wanted us to point them to resources, not only within our Department of Emergency Medicine, within UC, but also in the community. So for example, where are the cooling stations? How can we refer patients to cooling centers across town in an event of an extreme heat event in San Francisco? And again, like more ED specific, and again, yes, more ED specific climate solutions. And people were overall supportive of us developing a longitudinal curriculum. Lastly, perceived challenges include time. Where do we find the time to learn this material? And many respondents highlighted their own eco-anxiety as a potential barrier to learning this material. So how do we actually put this together in terms of framework and topics? And so we studied this published EM-specific climate change curriculum that was published in Academic Life in Emergency Medicine. It's a self-paced, open source, free curriculum that was developed and led by Dr. Caitlin Rubley, who is an emergency medicine physician at University of Colorado. And it really provided a nice framework and also supporting materials for Dr. Gandhi and I to start to develop our own ED-specific curriculum here at UCSF. So with this information, we approached our leadership and asked for time and space. And so they were overall had a pretty positive response and was supportive, but thought we could start off with a lecture series. So we were allotted 4 1-hour lecture time during last academic year, so 2022 to 2023. And last October, Dr. Gandhi and I led an overview of climate medicine. So we talked about an overview of the impact of climate change on health equity issues and why it's important for ED physicians to learn this and be leading in climate solutions. In December, we thought post COP27, post the publication of the last year's IPCC report, we wanted to talk about how climate policy would impact our clinical practice in the ED, and was fortunate to be able to invite Dr. Stefan Wheat, I think who's currently on the call from the University of Washington, and also Dr. Terry Connor from University of Colorado to come lead that discussion. In January, was able to invite in Dr. Jonathan Slutzman, who is also an emergency medicine physician at Mass Gen and a subject matter expert in healthcare sustainability, to lead a discussion on the topic. And in March of last year, our sort of last lecture for the last academic year, Dr. Caleb Trusser from Harvard, and also subject matter expert in extreme heat and air quality, came to lead our discussion. So I do think overall, it was a success. So success in that we had positive feedback from residents and faculty, and we got the thumbs up or green light from our ED education leadership team to develop and implement a longitudinal climate curriculum. Folks like that we invited, and these sessions were led by not only emergency medicine physicians, but subject matter experts in healthcare sustainability and extreme heat and climate policy, etc. And very exciting that we were able to recruit Dr. John Quinn onto our curriculum team, who was our chief resident last year and now currently our ED medical education fellow. In terms of lesson learned, so our program last year, or conference last year, was a hybrid in-person / Zoom model as we were transitioning out of our COVID, very restricted Zoom time. And it was not the most conducive to learning, in that we found that folks were there was a lack of focus. So if you were in person, it was hard to focus on Zoom, and vice versa. And so this year, our program has transitioned to only in-person sessions or only Zoom sessions. In terms of feedback from the lecture series specifically, we heard that some folks thought that there were a lack of perceived relevance to our day-to-day ED clinical work, and lack of perceived relevance to San Francisco or the Bay Area specifically. And I do think perhaps this is related to our own lived experience. Our climate is relatively mild in San Francisco, and fortunately, we have not had any extreme weather events. Lastly, we did hear from some residents that they think that this curriculum might be extracurricular, that they would prioritize other what perceived more clinically relevant topics, like how to put in an essential line, how to intubate, how to manage acute trauma and sepsis, as more important. So in terms of the next steps, we've applied for the UCSF Innovations Funding and Education Grant to develop this a longitudinal ED climate medicine curriculum. We've really taken in the feedback from last year, and in terms of increasing the clinical relevance, we want to do more case-based learning and match that or pair that with our system-based curriculum. So as an example, on our pulmonary block, we want to lead a discussion on the impacts of climate change on COPD exacerbations, an example. If we get 5 hours of curriculum time during one academic year, then we're planning to maybe break that down into smaller sessions, so 10 30-minute sessions, so with coming in with climate change issues and more frequency. And on one hand, people love that, like, we brought in emergency medicine physicians and subject matter experts, but it just so happened our friends and our colleagues were, in other universities, and we're thinking of maybe bringing it back to home more, and inviting more UCSF or UC-based facilitators and lecturers. And we're still brainstorming ideas of how learners can best learn in perhaps a non-lecture based format. So do we can we put together a extreme weather event like a simulation day? How about workshops or field trips? And we're still brainstorming these ideas. So with that, I'm going to end here, and thank you for your attention. These are our email addresses, and we'd love to hear from you any feedback or thoughts you might have on this particular curriculum. So,
Thanks, Hillary. That was fantastic. We have 9 minutes left, and there are a lot of great questions here in the webinar chat. I think I'm just going to highlight a couple of them. I think one issue that seems to keep arising is for those folks navigating barriers and getting climate and health implemented into their curricula, what types of strategies have succeeded for them, and then that there's a particular challenge at the clinical training level or graduate medical education level, that most of the successes have been in preclinical. And so if any of the panelists want to comment on that, that would be fantastic.
I think, Heather, you did a nice job kind of exploring some of the challenges, and just to reiterate our experience too, it's really about having champions that believe in this and understand the importance of it. And for us, actually, our students had a really big role in helping to bring this to the curriculum, because they were, speaking up to our faculty and our deans, saying, this is important and we need to be a part of it. And I think that also helped to raise the importance of the issue.
Thanks, Catherine.
And I would echo that. I think we're fortunate to have an advocate in the ED education leadership team that believe that this topic is important, and to allow the time and space for us to incorporate this into the core curriculum. So we really need a champion.
Yeah. And Orlando, did you have any comments, or should I move on to another question?
No, I think I was just reflecting on it, and I'm thinking about especially the course that I presented on, or the champion is definitely super important, and we have that in our leadership in the school. I will just make a quick push though, in terms of I think each semester, each quarter, the class size varies between 10 to 12 or 13 students. And every year we always survey the students and ask them, should we make the class bigger? Should we go bigger? And the comments so far 2 years in a row have been consistent. No, keep it small, because this is how we can, they felt like the topics were so unique and different that it needed a more intimate type setting. And so I just wanted to throw that out there for for folks who are listening, that take that into consideration as you're developing or thinking of your own ideas for a course.
Yeah, thanks, Orlando. I think that's a good point, because I think there's a tension between trying to expose all students to some climate and health content in the core curriculum, and then developing sort of climate champions, or folks who will go forward to do this work and be champions. I think that there's some additional questions here about what things are being done to incorporate this into curricula. So some of the resources already mentioned, the Global Consortium on Climate, Health, and Education and the CRHE project, are great. And then there's another resource that's been mentioned here by a couple of people that was just published to highlight as well. Why am I missing it right now? That was... we can send those afterwards, but there are a couple of resources out there that already have cases developed, and some of which are relevant to the GME level as well. So go ahead.
Sorry, I saw there's a question here from a second-year medical student around wanting to create a program or integrate climate-related content in medical school's curriculum, and getting pushback from faculty because it doesn't have any relevance to US MLE Step 1. And I think that's such an interesting question. I think if we didn't create this course in the school, like it felt as though students were going to move on their own and create affinity groups just to have the content and support each other around the content. And I think, I remember when I explained to a colleague in my own school, actually, that I was creating this course and it was going to show how climate change is impacting health. And my own colleague, who's a faculty in the school, said, well, I don't see the connection. How is climate change related to health? And I think you, as that student, you might want to do some of that teaching, because I had to do that with a colleague, and it was quite interesting. I think after I drew the parallels, the light bulbs went off and was like, oh, I could see that now. So for the student who asked the question, I think sadly, you're going to have to do some of the teaching on your side.
Yeah, I think that's true. And I would also say that there are student organizations out there that you can join, Medical Students for a Sustainable Future, that they've all been tackling these issues and really trying to work with their curricular leadership. And there have been some successes. Harvard recently is starting to incorporate this into their core curriculum in the medical school. And I know there are some other places, the Econ School of Medicine in New York, where they've had some limited success in incorporating this. And so it's just kind of a long game. But finding allies and finding strategies that have worked from others, I think, is really important. And then I just want to mention the resource I was trying to talk about before is called Medicine for a Changing Planet. And these are cases that from a collaboration from Stanford and University of Washington, students, faculty, trainees that are really fantastic. So check them out.
And I wanted to add, I think George Washington Medical School as well, like recently was able to add climate curriculum into their core curriculum. So I'm seeing these like threads or coming out of our discussion. I feel like what's needed is really kind of that top-down approach, where leading by these national organizations, like UME and GME, to perhaps put out a statement or lead in the fact that to address that this is an important issue to incorporate in the core curriculum. Perhaps with that leadership, it'll be easier for us to convince our own institutional leadership to incorporate more of this into our own curriculum. This is what I'm sort of drawing from the conversation so far. I just wanted to quickly address more ED specific questions that I see, but also I think related to our broader conversation. It's one about climate anxiety, and it's something that I thought about a lot when I was reading our ED survey, and that how do you draw that balance with presenting this overview of climate change and health and making more specific to our specialty, but also addressing this overwhelming topic as well. So wanted to see what your guys' thoughts are. For me, I felt that we've approached this in our ED curriculum in first, to address that eco-anxiety, climate anxiety is real. This is definitely an overwhelming topic, but then to focus on more solutions, more tangible solutions that we can address in our clinical setting.
Yeah, I'm just noticing we're about at time, so to let folks know. And I don't know if Catherine or Orlando wants to answer that question quickly. Catherine, you want to go ahead?
Sure. In our climate and mental health session, we actually have a opportunity for the students to look into a resource that was developed out of Australia about how to counsel patients who are experiencing climate-related anxiety. And so we encourage them to explore that and practice having that conversation as if how they would counsel a patient to cope. And I think through that experience, you yourself really benefit, right? Like learning by teaching. So that's one approach that I've used to help address that.
Yeah, that's great.
And I think I really like that response, because I find it difficult to answer that, only because the students like who are in this course, they live in areas where they themselves are suffering from that. They themselves are being impacted. Like one of the op-eds that letter to the editor that I showed was a student who lived in Tracy and in a heavy Latino community, and found that folks within her community, including her own family, were suffering from asthma, and really severe asthma, as a result of poor urban planning and the type of trees that were planted. And so she wrote that letter to bring attention and awareness to the issue. And so the students themselves, you have to keep that in mind, that so they themselves are potentially impacted by climate-related anxieties.
Absolutely. So we are 1 minute after 1 o'clock. So I just want to thank all of our panelists for your great presentations and all the great work you're doing in trying to move education forward in this space, and to thank all of the attendees. We really appreciate your being here and your engagement, and yeah, hope to continue discussions in future climate hubs. So thank you, everybody.
Thank you, everyone.